Welcome.
Good morning, or afternoon, I'm sorry. My name is Chase Bearden. I'm with the My Medicaid Matters campaign, and we are for the bill. First, I'd like to thank Representative Zerwas and Representative Turner for bringing forward bills that will create a healthier Texas and a productive Texas. As I said, I'm here representing My Medicaid Matters, made up of real people, real voices, looking for real reform. Our mission has been to help inform policymakers and fellow Texans about benefits of Medicaid. Medicaid to us means health, independence, children, and jobs. We are calling on Texas leaders to join with over 130 state and local organizations and over 8,000 signatures from different Texans that have signed on to the campaign over the last year. Medicaid currently does work. It works for over 3,593,507 real Texans. That's 2,605,000 children, 127,000 expectant mothers, 240,000 seniors, and over 500,000 Texans with disabilities. And you kind of might ask, why am I addressing current Medicaid recipients who currently are enrolled in Medicaid? And that's because it's being cited as one of the reasons not to expand. One of the issues that we have run into is not being able to get as many doctors, and I think that's something that has come up. But we've all known for the longest time the reason for that, and it has been the low provider rates that doctors won't take up as many patients. That's something we can fix, and something that if we fix, we will create a stronger program in Texas, not only for people in the future, but for those of us who are already using the program. What is also forgotten is the number of jobs that Medicaid program creates. And in a recent Ray Perryman report, they identified three major sources of economic gain from expanding Medicaid coverage. First, the health spending expands, generating gains in business activity. Second, uncompensated care is reduced, freeing up private funds to be used for other purposes in our state. And third, having health insurance reduces mortality rates, thus increasing productivity. We feel that Medicaid does work and will create a healthier Texas and a productive Texas for everyone in the future. Thank you.
Thank you. Representative Howard.
Thank you. Thank you for reminding us about the fact that the provider issue and access exists now with people that are currently not only in Medicaid but even private insureds. I mean, there's a shortage of health care providers in our state, regardless of whether we expand or not. So we need to be addressing this anyway.
It is an issue that many people on Medicaid face every day, trying to find someone. And John did bring up earlier finding specialists, and it's not that it's a broken system. It's that we just haven't paid the providers enough, and I think you can look at it like in the old baseball terms of you build it and they'll come. If we pay them, they'll come back to the system. Doctors want to get a good rate and serve the people they serve, but if they can't afford to do it, it's not because there's more paperwork and bureaucracy. It's because they need to get paid a rate that allows them to do the work they need to do and allow the people to be served that need to be served.
And it's also, I would suggest, and you can tell me if you agree with this or not, a multifaceted issue in terms of, I know we've been trying to make efforts in the Appropriations Committee this time to provide more graduate medical education funding so that we get more physicians through the pipeline and provide those opportunities, and also expand the capability of advanced practice nurses and physician assistants to be able to provide care as well. So several ways we need to be working toward getting more providers out there. Would you not agree?
Yes, we do completely.
Thank you for being here.
Thank you.
Thank you for coming today. We have some doorstops here.
We always like seeing them when we come in.
Okay.
Thank you.
Thank you.